by acknowledging that we are gathering here in Mi'kma'ki, myself and some of my colleagues here from Unama'ki, Cape Breton Island. So grateful to be able to gather in the spirit of reconciliation and always mindful of the treaties of peace and friendship. Just want to let you know, you probably noticed the screen pop up there, but we are recording this session, and we do that so we can share the conversations and discussions and information with members who are unable to attend in person. So just want to make sure everybody's aware that this is being recorded. I'm going to introduce our presenter today, Aron Ashton. Doubly excited because Aron is a dear friend of mine, and I feel like Aron, we met through community health boards like so long ago, so long ago. I was telling Judy and Charlotte that, oh my goodness, early on in my nonprofit career, on the side of my desk, I had a job working for one of our local community health boards, and being a bit of a facilitator and helper of organizing all of the asks that would come in from the community and working with the volunteer board to help decide where they were going to invest the funds of the board in the community projects. And just to share a bit of personal experience, I got to witness and be privy to some really incredible, inspiring, and just creative work that gets done because of contributions from community health boards. So I think it's really important that we're having this conversation today, and perhaps community health boards don't get the recognition that they should for all of the incredible work that they are part of facilitating in our community. So with that, I will stop talking and hand it over to Aron. So Aron is the public engagement for community health boards and support manager for the Eastern Zone. And really excited to have you with our members here today, Aron. So I'm going to hand over the screen to you to offer your presentation.
Great. Thanks, Amanda. And just do a little a shout out to Judy and Charlotte now too, just for helping with the setup of this too. So as we know, we're living in a very virtual world right now, and technology is always good to have a little trouble, to get some troubleshooting in there as well too, which we were able to do, thankfully. And I think Charlotte has control of the presentation. So I'm going to go through each slide, and then after I'm done with each slide, I'll just say the next slide, Charlotte. But yeah, I just want to thank Amanda and yourselves just for having me as well too. And I also want to thank Wesley Petit as well too. Wesley is I think works as the policy advisor with the Nova Scotia Federation of Municipalities, and we connected briefly, probably about a year ago, maybe 8 months, and the two of us just started talking. And similar to what Amanda said, there's definitely a lot that the CHBs can help with. And the more that Wesley and I began to talk, the more we realized that there's a lot of leverage points between what the municipalities do and what they mandate within their jurisdiction and their constituents, and subsequently the same thing, those same constituents are in those same communities too. So we're working on the same kind of determinants of health, population health approach when it comes to addressing different kinds of issues and barriers, as the municipalities are too. So I was just thankful that Wesley and I were able to connect, and obviously we made a connection. His buddy is a good buddy of mine, Robert McDonald. So we thought it was pretty cool when we started to make some of those connections, and 6 degrees of separation, if you will. So yeah, I'll do a bit of an overview. This presentation was used from the Provincial Council of Chairs, which I'll talk a little bit more about as they presented to the Nova Scotia Health leadership when Karen Oldfield and some of her colleagues started. So the Provincial Council Chairs presented this very similar kind of presentation right now to them. So very high level, a bit of an overview. We get into some of the weeds a little bit, but hopefully after the presentation, similar to what Amanda said before, you're going to become a little bit more familiar with CHBs, and you'll be able to even make some connections hopefully as well too. So yeah, that's I guess we'll fire it off right now. So we can go to slide 2, Charlotte, where it says overview. And this is just a little bit of what the next few slides are going to show us the bit of the background, the structure, the population health focus, as I said, that we really try to pay attention to. The community health plans, which are the piece that the community health board volunteers are legislatively responsible to create with the support of myself and the staff. And the partnerships advocacy, that's a big part of what guides and directs the work that CHBs do. Wellness funds and the alignment with the Speak Up for Healthcare report, and then just some of the conclusions. And then after that, we can open up for some questions. Next slide. All right, so a little bit of the background is back in the 90s, a few unincorporated CHBs began to form. Nothing official though. 1999, the Health Authorities Act, or Bill 34, was passed in Nova Scotia. This prompted the 37 health boards, and that gave them a legislative role, as I said before, in the health system. So in October of 2014, the government passed the Health Authorities Act, which created the Nova Scotia Health Authority, which formerly was the different regional health authorities. So the structure and outline, the legislative role of the community health boards became apparent. And then a couple of the things that happened after that is the considerable effort to share and create consistency, not necessarily uniformity, in the CHB role and practice. And then the other piece to this was the best and promising practices adopted from every part of the province. So a big part of what the health boards do in terms of where they line up or align with the health authority is they act as an advisory role. So a lot of the different things that come from the health plans, which I'll get into, that will be funneled up to the different Nova Scotia Health leadership, and the Nova Scotia Health leadership will use these health plans in an advisory capacity to help try to make some of those informed decisions. The primary focus on health promotion, which has continually evolved through the last 2 decades, from a modifiable risk factors perspective, the so-called health behaviors, to like more of an upstream population health approach, which is more around the healthy supportive environments. So I'm not sure if anyone heard the metaphor, the adage before about people that were flowing down the river and were almost drowning at the bottom of the river. That whole population health approach, or that upstream approach, is actually going up to where people were falling in the river to try to prevent them from falling in. So to avoid some of those the backlashes of what we're dealing with right now in the healthcare system, which is just everything's exhausted right now and spread very thin. So in 2021, the CHB review, actually that just happened within the last year. This is the first time in 20 plus years that the CHB program in and of itself has been reviewed. So long overdue, but there was hundreds and hundreds of people that were engaged, volunteers, staff, internal, external stakeholders, partners, which basically explored the art of possibility for helping the CHBs to achieve. And a lot of the achievements right now are solely put on the volunteers and really what they've done to actually expand the CHBs and really expose them for what they are, which is a lot of what Amanda said before is a really good community asset. Next slide. So the next slide is what do CHBs do? And for those of you who are not familiar, this is exactly why I'm really glad to be here. Some of you are familiar with the CHBs, others may not be, and people may have some of their preconceived notions of what CHBs are. But if you're not familiar with CHBs, they're a group of volunteers from your community working together to improve the health and wellness where we live, where we work, where we play, and where we learn. And the community health boards gather ideas. They share information about how to improve and promote health and wellness close to home. They focus on the many factors that affect health and wellness in our communities, including the determinants of health, which I mentioned before. And some of the big parts that really guide the work is income, education, and sense of belonging, among others. They also share what they have learned about health and wellness priorities within their communities, Nova Scotia Health and the IWK Health Center, and other community groups as well. And the CHBs continually advocate for actions to promote and improve health and wellness based on communities and what they say is most important, what those particular communities say is most important. So those the actual priorities. And they're guided by the community health plan. So I'll get a little bit more into that, but they develop these partnerships with local community groups, and eventually they award, or annually they award wellness fund grants to local community projects as well. Next slide. So this is just a very bit of a brief map, or like at least a scene of what the 37 community health boards look like in the province. So the CHBs exist in the western zone. There's 11, 10 that are in the northern zone, 9 in the eastern zone, which spans from the at least Antigonish through to the industrial part of Cape Breton. And then there's the 7 that are in the central zone. So that's a little bit of a breakdown. This is one of the things too that has been addressed in the CHB review as far as boundaries go. So because of all the things that have happened, with the school boards, with the zoning of the health authorities and other things, the CHBs have yet to change. So the good thing about the review happening when it did is that this was actually addressed, that boundaries have to be dealt with further. So which will probably require another community engagement session down the road. But this is just a bit of a breakdown of what the 37 CHBs look like within the 4 respective zones. Next slide. And this is a little bit of the people power of the CHB. So one of the things that I will mention just based on this slide is recruitment has been a challenge. We've been on a bit of a downward spiral the last couple of years. Obviously, COVID hasn't helped, but that's actually one of the things that I've been tasked with, is to actually try to operationalize the recruitment strategy. So different things have come forward based on volunteers through the Canadian Code for Volunteer Involvement. So this is one of the things that we're using to help try to guide us in making decisions around recruitment and how to actually promote recruitment within the CHBs. And first and foremost, a community health board volunteer is a Nova Scotia Health volunteer first, and then then after the processes are taken care of in terms of orientation and record checks, then they're lined up and matched up with the CHB that falls within their jurisdiction as well. But recruitment's been a challenge. We're working on that. On average, CHBs are operating at about 50% capacity, and in the Health Authorities Act, the part of the governance was that there was between a minimum of 9 and a maximum of 15 CHB members to each of the 37 CHBs. Currently, there's only 27 right now that actually fall within that range, and there's 9 that actually don't have that. So more than likely, the 9 that don't have that are the ones that fall below the actual minimum amount of 9 CHB members. And some of the opportunities that present itself in terms of being a CHB member are the increasing engagement within community. So a lot of the big thing that happens with recruitment is through word of mouth. Also increasing partnerships, and then the organizational support for the public engagement and communications piece as well too. Next slide. So this is just a bit of what community health boards do in their communities, as I mentioned before. So there's a lot of engagement, the legislative responsibility to create health plans. There's a lot of local implementation of the community health plan. So as a zone, we'll create a health plan that will be distributed throughout the Nova Scotia Health leadership for them to respond to see how they can support us. But that other piece right now is what the community health plans do is there's also the local piece. So the Think Global, Act Local, that's what these health plans do in terms of trying to implement and address the priorities that are at the local community level, and also looking at those local partnerships as well too, and really trying to solidify those local partnerships to help with one another. Advocacy is a big part, and then obviously the wellness funds is that main stream of funding. Next slide. So as I mentioned before, there was I had talked about the provincial council of chairs. So The way that it's set up right now is that of the 4 zones, each zone has a council of chairs, which consists of 1 or 2 CHB members. So each community health board has a chair and a co-chair, and those two people represent their CHB at the zone council of chairs. So in our case, with the Eastern Zone, where there's 9 community health boards, there are a couple boards that only have one chair, but there's also a couple boards that have 2. So we're looking at about 13 or 14 people that come together from the Eastern Zone that meet quarterly and have the opportunity to network and also share some of the stories and experiences of community health boards, and bring forth some concerns as well too. So if there's any kinds of gaps that may exist with certain CHBs or as a zone, then that's the time and opportunity that we address them. So we're pretty fortunate to have people like Brett McDougall and Madonna McDonald, who were the VP and directors respectively of the operations for the Eastern Zone, attend our zone council of chairs, and they provide updates from a bit of a broader perspective in terms of the Nova Scotia Health Authority and different things that are happening at each site. And what ends up happening from the zone council of chairs is that information gets shared at the provincial council of chairs. So each zone gets 1 or 2 representatives, most likely someone from the zone council of chairs. So a chair and a co-chair from the zone council of chairs becomes part of the provincial council of chairs. So you're seeing a little bit of a layered effect right now, and it just adds to the other pieces right now about how important the conversation happens at the local, at the zone, and then at the provincial level. So the provincial council of chairs, for example, as I said before, the same presentation was used to present to Karen Oldfield and some of her colleagues right now as they started their work with Nova Scotia Health. And the same kinds of things can be said for different kinds of letters of support and advocacy around some of the different priorities that come from each of the zones, whether it's poverty, social isolation, housing, food security. Those are things right now that are really surfacing and that aren't just exclusive to one zone, but we're seeing right now this trend around the entire province. So that's these platforms right now that the CHBs have at the zone and provincial level are really helpful to try to broaden the scope of the work and just really understand where everyone fits and know that there's not a lot of these exclusive concerns and problems that are happening at the zone, but it's happening at the provincial level too. Next slide. So I mentioned before the community health plans. This is a big part of what the CHBs do. Before, or formerly, it was the community health plans were done every 3 years. But as you're probably aware as well too, that the 3 years isn't really a lot of time to get things done and to really solidify a lot of the work. So we were able to update and expand the amount of time that we have between health plans to 5 years. So it's in my eyes, it's still really not a lot, because from the last time we've had the health plans to the health planning that's going to start very soon, actually in the fall, there's probably not a lot of changes. If anything, and what COVID has exposed is that we'll probably continue working on the previous health plan priorities, but we might with just a bit of a different lens. So that's really what's going to happen soon. And I think that the timeliness of connecting with you today is that, as I mentioned before, there's some of these great leverage points that I think we can take advantage of. And as the community health plan process starts to roll out, that will include going out to the communities and engaging the communities, doing in person as comfortable as people will feel, getting together in person. We'll also have online surveys, and we'll also do other kinds of focus groups as well too. So really, we want to get a good representation of what the community is saying that they need in their communities, and that's what we're going to be able to do through these health plans. And that'll take roughly We'll actually develop that and then publish it probably by May of 2024. Between May and June of 2024 is when those health plans will become available. Next slide. This is just a bit of a better look at through this infographic as really what guides the work of the community health boards. So as we mentioned, or as I mentioned before, the social determinants of health really guide the work of the CHBs, and that's that upstream preventative approach to healthcare. So this slide shows us that health services account for roughly about 20% of the factors that influence our health. And this is a quote from Jeff Wilson, who's my director of the public engagement team and the community health board support. One of the other pieces of that is when we see some of the data like this, the changing health outcomes require us to address like the other 80%. And factors such as education, income, access to nutrition, housing, transportation, these all have very profound effects on our well-being. And that's why it's a big part of the conversation right now. So the fact that the conversation about health has changed fundamentally since the community health boards came on stream, like I said, 20 years ago. This is where we've been involved with, and one of the other colleagues that I work with is Jimmy Kay. He's been with the program for that entire time, and he realizes just how important taking the look at the other 80% of what determines our health. And so the CHBs have shifted the focus to creating a culture of health and wellness. And now it's about helping people gain access to such things as affordable food and opportunities for physical activity and social interaction. So this just sort of encompasses what the CHBs use to guide their work. Okay, next slide. I briefly touched upon this before, but that's that upstream approach, and more with looking at it from a dollar value. So the return of investment estimates are very conservative, being based solely on savings and healthcare costs alone, without considering other societal costs such as lost productivity, for example. So many studies also show the return on investment in Canada of disease and injury prevention and health promotion interventions. So this breaks it down a little bit further as to really how the community impact can really have a big impact on other aspects of the community that we live in right now. If you're looking upstream, if you're looking prevention, and if you're looking at health promotion. Next slide. So the next few slides, I'm going to just spend a little bit of time talking about each of the respective zone plans, and you'll start to see some of the common threads, as I mentioned before, about some of the priorities that exist in one zone also exist in the other zone as well too. So Western, for example, their four priorities were they're working together to improve food security, availability, and access to healthy living, recreation, and wellness programs. Working together on issues of safe, affordable, appropriate housing, and then the opportunities for connections, inclusion, and supportive community environments. And some of the things that come from this, so after each health plan is created and the 3 to 4 priorities are created, there's also some recommendations that are put forward. And these recommendations are the ones that the Nova Scotia Health leadership would look at. So for example, in terms of working together to improve food security, some of the recommendations were the CHB recommends that Nova Scotia Health leadership work with community partners to advocate for investments that benefits all students equitably, such as the National School Food Program. Another one for the availability and access to healthy living, the CHBs recommend that the Nova Scotia Health leadership work with partners to increase availability of community-based healthy living, recreation, and wellness opportunities. And as far as working together on issues of safe, affordable, appropriate housing, the CHB recommends that Nova Scotia Health identify the impacts of insecure housing on programs and in community. So that's just an example of what's happening in the Western Zone. And like I was saying before, there's going to be a new health plan that's going to be developed by May 2024. So these will still be very much in effect and what's going to be guiding the work until the new health plans are created in the next 2 years. And next slide. So for the northern zone, the 4 priorities are what you see in front of you, and some of the recommendations that would come out of those. For mental wellness and sense of belonging, the CHB recommends that Nova Scotia Health leadership support the work of community stakeholders to ensure everyone has equitable access to services through navigation, outreach, and/or transportation assistance. Another recommendation for healthy active lifestyle is the recommendation to develop and monitor plans to connect and engage community partners and all levels of government to implement policies that address accessibility and inclusion. And I know these words, I've heard very similar words used, yeah, even just through Amanda in the CBRM, among other places as well too. So I'm very familiar that you're familiar with a lot of the recommendations that I'm speaking of. But I guess the point is that the CHBs are saying a lot of the same thing. So it's don't have to reinvent the wheel. But if we're hearing a lot of the same things repeated and echoed in different platforms, then I think it's something good to work from. Next slide. So for the Eastern Zone, we're looking at these were the 4 priorities that came out within probably the last 2 years. And some of the recommendations are recommended that Nova Scotia Health leadership will establish a coordinated approach to address issues of poverty through partnerships and shared resources, which include but are not limited to the awareness of the early childhood development indicators, improving food security, and advocating for access to living wage. Excuse me, equitable access to health services. So they were recommending that Nova Scotia Health leadership support the community stakeholders and work to identify and reduce barriers to equitable access to health services, directly impacting the people of the communities in different ways through either culture, education, transportation, and rural isolation. Social inclusion. The recommendation for Nova Scotia Health was to develop monitor plans to connect and engage community partners to implement policies that address accessibility and inclusion. And next slide. So the Central Zone, excuse me, actually the very first priority is equitable access to health services and information. So already you're seeing the word equity being used a lot. And the recommendation around that is for the Nova Scotia Health to develop a more culturally competent health system. As far as working together and upstream, the recommendation was for leadership to work with the community stakeholders, academia, municipalities, and provincial departments to support and develop strategies to ensure equitable access again to safe foods. And as far as supporting community environments, the recommendation is for the Nova Scotia Health to invest in community-led health promotion initiatives. And next slide. So this is just reaffirming right now a point that I made earlier on about the local implementation of the community health plans. So this really solidifies the CHBs working directly with the local community. So each of the 9 CHBs, for example, in the Eastern Zone, and subsequently the other 36 that exist in the province, each CHB will work together as a group of people to actually provide the support that they feel that the community needs, whether it's through wellness funds or through the health plan implementation dollars. So there's 2 streams of funding that community health boards get, and it's almost a shoestring. There's not a lot. So the CHBs are very resourceful, but the wellness funds come out annually. And there's a process right now that you can go through to actually apply for wellness funds, and it's online. We've just switched to an online through SurveyMonkey. So that's going to be something new that we transition with, but we're hoping that we'll get some good uptake as well too. Also keeping in mind too that we have other opportunities for people to apply for wellness funds if they're not computer savvy or if they don't have the same kind of internet connections. There are the older traditional options of either printing off or receiving a copy and then filling it out manually. So once these health plans are created, that's really a lot of what the community health boards do, is to support their communities to try to actually get that funding. And it's really startup cost or startup funding in hopes that there's other organizations or NGOs that can provide some more support of funding that can really make those initiatives sustainable. Next slide. And I mentioned this a few times now about the advocacy and partnerships. This is one of the elements of the work that has been able to continue throughout COVID. And in fact, some issues such as addressing poverty through universal basic income have gained traction during this time as well too. So an example is the Kingston Greenwood Community Health Board. They hosted a virtual session, learning session on basic income, which was attended by members of other community health boards in the Western Zone. And since then, there's multiple community health boards across the Western Zone that have spoken out in support of basic income through letter writing to federal representatives and raising awareness in the communities. The Western Kings Community Health Board took the lead on advocating for a national school food program. So they're working with staff from public health to create the advocacy letter that was adapted and sent by other CHBs that went across the zone. And besides advocating for federal policy change in the priority areas, the CHBs are also active in advocacy work at the local level. So Lunenburg County, for example, made a presentation to Bridgewater Chamber of Commerce, encouraging local business to offer sensory-friendly shopping times for those living with autism recovering from concussions. And the sensory-friendly shopping is a way to create, again, more of the inclusive spaces within the community. And as far as basic income and the National School Food Program, Yarmouth County, CHB, has been involved in advocating for reopening the Yarmouth YMCA, which closed indefinitely due to COVID-19. And the town of Yarmouth now purchased the building, and they're waiting to see whether they will actually be able to reopen the facility. So it's encouraging. And these are things that are all done at that CHB level where people at that grassroots have the passion to really try to push the envelope. In this particular case with Yarmouth, this would be a stopgap until the facility can be built. So potentially as part of the Mariner Center. Next slide. Advocacy with the national and provincial partners. So there's the picture that you see right now is part of thousands of people that are gathered in person in their schools and at home or online with friends or colleagues that highlighted the importance of the healthy food at school and a call for the Healthy School Food Program for Canada. So they partnered with the Nova Scotia Coalition for Healthy Foods, schools, and other partners to provide apples to students. So it was a big success, as you can see. It's called the Great Big Crunch, and it happened in Annapolis and Colchester counties. Like I said, with about 4,000 students who met in person. Next slide. And just these are some other examples of advocacy and partnership happening respectively in each zone. So Western Zone, the Kings County Postcard. This was a collaboration right now. The CHB is partnering with community organizations to distribute postcards to community members, adding their voice by mailing to MPs and senators. Postcards provided awareness and action that can be taken to address each community health plan priority area. And the Northern Zone, Pictou County Mental Wellness Roundtable, the CHB held a resiliency event with Dr. Michael Unger and published the mental wellness at work after a COVID document. Okay, next slide. And in the Eastern Zone, I was fortunate to be part of the two. One of the coordinators that I work with, Dorothy Bennett, she's responsible for the Antigonish, Guysborough, and Strait CHBs. She created a Spark a Connection. Originally, before COVID, this was going to be in person, but the theme of the Spark a Connection was to address social isolation. We had a great turnout for virtually. We actually had little pods around the province, and there were some international speakers that spoke about social isolation and the data that exists. And from that, like we do with any kind of event, we're always trying to promote recruitment, and we're always trying to promote wellness funds. So we were able to recruit a few people through that event, as well as a few people and a few organizations applied for and were successful with wellness funds too. So that's always good and encouraging. And finally, Central Zone, they did the safe and affordable housing, and they partnered with the Autism for Women and Children and Affordable Housing Nova Scotia to prepare a submission to all three levels of government. And next slide. So a little bit more about the Wellness Fund. This just breaks down what the Wellness Funds do. And So as you can see, like $700,000, it's pretty significant in the quantitative part. But when you try to break down $700,000 over the province of Nova Scotia, it really doesn't add to a lot. Essentially, what ends up happening is that for every 3 wellness fund applications we receive, we're only able to really ever provide support, financial support for 1. So we've advocated for years right now to actually try to up that. It would be great if Department of Health and Wellness was able to provide $1 million, but we know that there's a lot of other stretched programs right now that the Health Authority and Department of Health and Wellness is dealing with. But that fluctuates between $700,000 and $720,000. And we're usually funding about an average of 450 projects in smaller amounts. For the pandemic, we increased that amount, the maximum award, from 3,000 to 10,000. So the 450 projects are usually what we see annually across the program, the province. And when COVID happened, we were able to increase the minimum amount of 3,000 is what we usually award, to 10,000. And we were able to successfully provide a few of the programs with the $10,000, which was a big help to them. And yeah, a lot of the pieces around wellness funds right now, at least what we've been trying to amend and modify, is around the diversity of the applicants and the social and economic determinants that they address. So really, we're really trying to look at some of these pieces and seeing what kind of impact they're going to have with the group of individuals they're actually trying to support. So for example, I mean, we've got applications from the Mi'kmaq, African Nova Scotian, 2S, LGBTQIA+, CNIB, and the persons with exceptionalities as well too. So autism support, physical accessibility adaptations as well too. So it's a little bit more rich in diversity, but I know that there's opportunities right now, and maybe with even more funding, if we ever did receive that, we could provide even more support. Next slide. So just a little bit more, the Annapolis Community Health Board, they funded an Afrocentric drumming project at the Clark Rutherford School. The project was geared towards students with African ancestry or Mi'kmaq heritage who participated in drum circles with Dr. Henry Bishop. And the goal was to increase their confidence and sense of belonging. The Eastern Kings and Central Kings and Western Kings, they all collaborated, and they awarded a wellness fund to what was called the Flying Squirrel Adventures. And that was a program offering free outings for all ages, inspiring outdoor settings. The program included facilitated activities and free time for participants to experience nature at their own pace. And unfortunately, like I think a caveat to everything I say, there's always the COVID. But because of COVID, the outings were canceled. But before the program was completed, the organizers pivoted quickly, and they were actually able to use the wellness funds to distribute nature craft kits to program participants instead. So that's the other thing that I mentioned before about the CHBs and even the support staff trying to be really flexible and accommodating and allow for that pivoting and the resourcefulness, or just that creative thought about, okay, we can't do this. How can we actually help in some other way? And Lunenburg, Lunenburg County actually did a pretty cool thing. They supported online youth cooking program through the YMCA's King Street Youth Center. So this program filled a gap for youth who weren't able to attend the on-site program that was offered in Bridgewater. And through the pandemic, the online option was allowed, that has allowed youth to make decisions on what meals to focus on and develop their scripts. So now that they're able to get together again, they've been able to begin videoing, which is fortunate for the youth in this program. So they're able to engage during a challenging time, develop a program that will benefit, will be a benefit to many. And next slide. So I was mentioning before, we spend nearly a third of our lives at work. And it's exciting to see, as an example here, the Chamber of Commerce supporting employers with health promotion programs. So as you see what's happening in the Northern Zone. And Central provides opportunities for health professionals, Family Resources, and the Department of Education and Community Services to present and share information and resources with community members. So the programs target people living in poverty within the African Nova Scotian communities of the Prestons. Next slide. This is just a little bit of some testimonials about the wellness funds, and people just saying that the kind of impact they've either had in their program, or just the other piece sometimes of saying that, you know, if there was a little bit more to work with, then obviously that money could go a little bit further. Because as I mentioned before, what some of these CHBs have been able to do with their communities in terms of spreading that money across to make sure that these programs are they are maintained, and they're sustained after a certain period of time, and two, to actually really thrive. Some of these programs have really thrived because of the support they've received from wellness funds or health plan implementation as well. Next slide. So I mentioned before that at the beginning I was going to talk a little bit more about the Speak Up for Healthcare report. So this validates the work of the CHBs and reinforces the need for them. It's important though that the health system leadership as well as community partners are aware of and engage with CHBs on these issues. So something that Amanda mentioned just in the beginning is that even within Nova Scotia Health, we're overlooked. There's I'm not going to lie, there's definitely some programs and people within Nova Scotia Health that don't know what a CHB is. So anytime and any opportunity that we get to actually present information about CHBs is great, but also when people hear about what the good things that CHBs are doing, then it goes a long way. The community health plans already include broad recommendations on the issues and more for Nova Scotia Health, the CHBs, and their partners. The implementation of these plans can only be enhanced with greater collaboration and engagement, which is what's happening here, between the leadership, community partners, and the CHBs. So the investment of resources, including time and attention to connect with CHBs, that's vital as well. Next slide. The education behind the, at least for the Speak Up for Healthcare report, we're looking at always trying to advocate for and on behalf of CHBs for general awareness and creating the healthy supportive environments rather than focusing on the individual education. So participants felt this could be supported through the work with advocacy organizations such as housing, the greater education, food, nutrition, and through the legislative action as well, through raising the minimum wage. So there's a common thread if you picked up on what the CHBs have continually tried to advocate for and have tried to push and find some of those other community partners that are looking for the same kind of support. So in conclusion, through the community engagement, wellness funds, partnerships, advocacy, CHBs have real impact in our communities, as you can see. Before, during, and after the heart of the pandemic, the CHBs were steadfast in their work. The focus was on population health and the determinants of health. The community health plan implementation through partnerships and advocacy was key. Many virtual events as well as in person where possible. I can tell you that was actually something that was welcomed as soon as those tiers started to loosen a little bit and the restrictions started to loosen. People wanted to take advantage of being in person as much as possible. Wellness funds, they're enhanced with special rules to support organizations differently. Recruitment has been ongoing, and then the CHB support staff, that was the other thing that actually happened too, is that there was probably on multiple occasions, between 2 or 3 times, there were staff around the province that were actually deployed to public health. But the CHBs kept going, but there was different ways that we stayed connected with it too. So a lot of props to the resiliency, to the adversity, to their patience. We try to acknowledge them whenever we can, through different manners, that whether it's just trying to create events for them or find out what's happening in the other parts of the provinces when it comes to trying to use that best practice to engage and to really acknowledge the CHBs and the volunteers, because as you know, if you volunteered before, there's probably we see a lot of the same volunteers that are doing the CHB that are volunteering elsewhere, whether it's coaching or other parts of the community. So we really want to make it a point to know just how much we appreciate their efforts. So, yeah, and that's it. Next slide was just if there's anybody has any questions.
Well, thanks, Aron. Really thorough presentation on, gosh, all the important work that is being done through the community health boards in our communities. Yeah, initially I had spoken about the grants, obviously, that really allow the community to lead projects and put these priorities and health determinants into play. But I failed to mention the importance, as well as the data that's collected and shared as well. Those reports are so mindful of what's happening on the ground in our various regions. And I think it's important to point out as well that, going through those lists of priorities based on regions, it's not often that we see, I suppose you could say, the unique needs of our regions reflected. Often we'll have an overarching view of what's happening in the province, but that might not fit what's happening in Yarmouth, what's happening in Amherst, what's happening in Cape Breton, because there are so many unique geographies, demographics, issues, you name it. So it's really it's a really welcomed approach to see that regional perspective being the focal point of priority setting and actions, right? So what I'll do right now, I have the chat open. Does anybody have any questions directly for Aron? I know some folks had mentioned that they would like to see a copy of the presentation. So like I said before, this is all being recorded so we can share with the membership, and the presentation is also going to be shared around as well. So just want to make sure folks know that. Oh, Councillor Gordon McDonald, go ahead.
Thanks, Mayor McDougall. Yeah, and thanks, Aron, for your presentation. It's good to see you again.
Yeah, you too.
So I have a couple of questions regarding the community health boards and just what's happening in the Eastern Zone that we are with here in Cape Breton. Just wondering on, so just for clarity, first of all, so the community health boards are not participating in any doctor recruitment whatsoever, correct?
Correct. Yep.
Okay. And that's left to the Nova Scotia Health Authority.
Yeah, and more specifically, people services. Yep.
Okay. So I'll get to the former district health boards in a second. Because, yeah, so on the community health boards, so locally here in the Eastern Zone, you're talking about food security and how that is part of the health, the wellness of communities. I'm just wondering locally here, because I know for food security for me has been something I've been trying to work on to get a project started here in my district, at least for the last 2 years since I've been elected. So just wondering if there are any projects going on presently in the Eastern Zone that we could look into, or even throughout the other the health boards across the province that we can look at as an example that's actually happened and actually is starting to work in that way. So that's one question. So the Wellness Fund grant, how is that accessible? And can you give a broader description of what projects it's used?
So go ahead.
Okay,
go ahead. So
no, go ahead. You can answer them as you go. So
I'll answer the one about the wellness funds. So we have that's the wellness fund application can be accessed online. So if you were to go onto the search engine of community health boards, then that would take you right to the home page. And then just on the bottom right hand side, you'd actually have the little icons that you can click on, and that'll actually take you right to the wellness fund application that you need to. Now, whether you want to do it online is one thing. If you, like I said before, if you have the computer savvy filling it out online, it's pretty simple right now, and just in terms of being prompted. If you didn't want to fill it out online, then you could either print it off, or someone could actually one of the coordinators could send it to you, and you can fill it out either through a PDF or you could print it off and fill it out manually. Because we do know that there are people have different kinds of issues and barriers when it comes to actually the wellness fund application. So we've tried to make it as easy and as accessible as possible for filling it out. Now, that doesn't take away from the fact that it's still like the process. Some people are complaining sometimes that the process of filling out, 4 or 5 pages of an application doesn't really equate to the amount of money that they're going to receive. So that's something that we've always been trying to modify. And with, at least with online, that process, we're hoping that we'll almost cut that application process in half in terms of being able to apply and fill that out. So when the wellness funds come through, what ends up happening is that myself, excuse me, and the other staff will screen the wellness funds in based on certain criteria. So that criteria will be if the organization basically just put a new date on a same wellness fund and didn't do anything else to fill it out, that wouldn't necessarily pass that screening step. If there was other pieces right now, if there was other parts of the wellness fund application that were completed, then that coordinator most likely will go back and say, hey, listen, they'll go back to the program or the organization that's applying and say, hey, this is not filled out properly, or hey, can you be a little bit more specific here? So the coordinator is that facilitator with the organization applying for wellness fund that really helps try to bolster that application. And then once those are screened in, then it's out of our hands. Then it's all the community health boards. So each of the CHBs will take that and they'll have a little a wellness fund planning committee, a screening committee, and there'll be maybe 3 or 4 of them. And they'll look at each one of those wellness funds that get screened in, and they'll say, okay, yes, we can award this program or this organization this much money, or no, we can't provide them the full amount, but hey, I think we can provide them a little bit here and there. So it just comes back down to that amount of money right now that we don't have, that could go a lot further if we did have more.
Thanks. What about the food security?
Food security. So yeah, there's a lot of different things right now that's happening. The CHBs, and when it comes to food security, they're really working with like the food coalitions to support the different kind of work that's happening, whether it's providing in-kind services, or if it's providing even data. Sometimes if there's data that exists that CHBs have access to, and when I say the CHBs, it's more likely the staff that provide that information to the CHBs. So a lot of the food security work that's happening right now is the CHBs working or advocating on behalf of their communities to actually push the thing through, whether it's the Feed Nova Scotia, anything that's happening at that level, community cares, if there's anything that's food security related that's going on there. So there's a lot of the talk right now, the school food program. That's one of the things that one of the coordinators, Dorothy, as I mentioned before, she started to put that letter of support around that's going to go into the federal policy or the federal level, just to say that there's more support right now that's needed in the schools. And there's probably, of the wellness funds that have come in, I was able to calculate through a scan over the last few years that there was almost $750,000 that the schools, that was either a wellness fund that was from a school that was looking for support or looking for food related support. So there's a lot of things happening right now at the school level that the CHBs are also supporting as well.
Okay, and if you don't mind, I got a couple more questions before if the mayor's okay with that.
Mm-hmm.
So another thing that you mentioned is mental health and addiction. So I'm just wondering where in the Eastern Zone, because we have a huge problem with mental health and addiction, probably not just here in the Eastern Zone, but it seems to be very severe in Cape Breton. And I can't speak for the rest of the province, obviously, because I'm not there. So I'm just wondering, like, when it comes to mental health and addiction, like, what is it that the community health boards are actually doing to support this, because we have such a shortage of the resources around mental health and addiction. And like, how, if we have an issue, say with someone in the district that needs some support, how are we able to get that support through with our community health boards, and who would we contact if we had a situation?
Mhm. So the one thing that I can tell you that that's happening is there's, so the report or the health plan that came out that I mentioned before, the 4 different priorities. So mental health and wellness was a piece right now that we felt within the Eastern Zone, and I can't speak for the other zones because they didn't have actually the mental health and wellness as a priority. But what we ended up doing in the Eastern Zone is we actually took that, and that's embedded through each of the other 3 priorities. So equitable access to health services, poverty, and social isolation. So we looked at that as mental health and wellness being part and parcel of all those other things. So when somebody's living in poverty, either they're dealing with some kind of mental illness, or it's going to exacerbate something, and they could have a mental illness, and it could be exacerbated through that. So same with social isolation, and then the same with the equitable access to health services. So one of the other things that we're trying to do is build capacity within the CHB volunteers. So we as staff will get trained either through LMS, which is a platform that we use, through other to build like a competency around understanding how to deal with and address people with mental wellness. And when I say people, I mean the communities. Like we're looking at communities right now. And then we take that and then we try to transfer that over to the volunteers. So one of the things that we tell volunteers that we use as a recruitment tactic as well is that you're coming with certain skills and assets, but we're also going to teach those same skills and assets by professionals within the health authority. So we have trained professionals that would lead different CHB initiatives where we would be doing some competency training with the volunteers to be part of that, to be part of the community. And so they're a little bit more familiar with whether it's being more culturally competent or being more aware of people that are in the community that are living with mental illnesses. So there was a mental first aid training that's been provided to a few CHBs around the province. So members of the CHB, I think in Central Cape Breton, they received the mental health first aid training. And just recently, there's also some other training that they went through with external consultants. They came in and they started to treat them, or they started to teach them and train them about cultural competency and being familiar with the Indigenous and anti-racism pieces of living in a community and understanding what that looks like in terms of engaging the communities when it comes to health planning. So those are just a couple pieces off the top of my head that I can think of about the ways to try to address that.
Yeah, no, it gives me a clear understanding of what your role is on that mental health and addiction. So just one more thing, if you don't mind. And does the community health boards help individuals, let's say, with housing, finding housing? And because we are in such a housing crisis right now, and it is a crisis, I'm just wondering, like, do community health boards have any advocacy work that they are doing to be able to find places for people? Because as you can tell, everything that we spoke about here today all eventually grows into one thing, and it's about people's mental health and the ability to function in communities. So I'm just wondering, how do you advocate for the housing, and can an individual access it, or do you as a health board assist people with that kind of situation?
Yeah, that's a good question, Gordon. And one of the things that we've tried to do before is to be as accommodating to anyone who actually is looking for that support. So I think the more than anything, we're going to see that if because housing, because food security is coming through as something that is impacting a lot of people, we'll try to create events where we'll invite people, or we'll create gatherings where we'll address that with those people that might have the issues or might have questions. So if we start to hear this trend and this theme, that's usually what we do. Is the CHBs are saying, okay, how about we create an event? Let's bring all these people together. Let's find out who supports housing, whether it's Housing First or the homelessness initiative. Let's bring them into the picture and let's have them have the conversation. Let's figure out ways to actually get people that are maybe have precarious housing situations, bring them in the mix. So that means that we're having to address barriers. If we're trying to host an event, we know that maybe not everyone's going to be able to get to that event. So we got to think about transportation. We got to think about food. In other cases, we've thought about childcare as well too. So all these times that when these kinds of events have been created before, we're addressing these kinds of barriers so we can get the people that have the challenges to some of these events to actually speak to, and so we can hear that that lived experience.
Thanks, Aron.
Yep. Thanks, Gordon. I love your questions.
I echo Aaron's comment there, Gordon. Thank you so much for all of that insight and questions too. It helps. I think it helps us further understand the capacity of the health boards too. And I keep thinking about the point that you made about housing, Gordon, and everything comes back to this lens of housing first, that concept of when a person has a home, when a person has the dignity of a safe place to go to, some of those other elements immediately kind of dissipate. So really important that we bring that into the conversation. I did note in the chat that Paula had a great question around, seeking volunteers, because these are very much oriented around volunteers. So what is the criteria when we're looking for volunteers? And I see here, when we are looking for volunteers, can we look to have people from backgrounds of housing, food security, Red Seal chefs, medical fields? So Aron, if you don't mind kind of indulging us a little bit in the makeup, I guess you could say, of the community health boards, is there any strategic kind of positions that you're looking for in backgrounds?
Yeah, no, thanks for that. The board composition of the CHBs, they're diverse in some aspects where everyone has bringing their own kind of lived experience, but it's never as diverse and rich as we would like the CHBs to be when it comes to having the people that are from priority seeking or marginalized communities and populations. So we're always trying to figure out how we can acknowledge that piece, but we also are aware that some of those same people that are marginalized may not always feel like they're welcomed in that CHB realm, because as an example, I'm just thinking of the Indigenous communities as well too. We're a very strict kind of Eurocentric minutes plan, all these things that we found out from one of the Indigenous consultant, Aron Prosper. We connected and consulted with him because we were trying to figure out how our board composition can become more culturally diverse. And he says, you may never get that. He says, until you actually fall out of that Eurocentric system of planning, you may never get the representation or the people from communities that you'd like to hear their voice. And I'm almost thinking about the word representation. I don't like to use that because one person is not representing entire cultural community. That can never be the case. But I think more than anything is that we're trying to build the capacity and the awareness of CHBs with everyone, so people can make their own decisions if they feel it's a fit for them. It would be great to have a broad skill set, and we usually do. But as far as criteria goes, there's never really any kind of criteria. I think the only thing that would hold anyone back is a criminal record check. And that goes through Nova Scotia Health when they're going to do their orientation. So if people want to become volunteers and they go through the process with Nova Scotia Health and they feel like it's a fit, they usually someone usually connects with the coordinator or the chair. And as I said before, it's word of mouth. That's where that conversation starts. And then they can, we direct people, if they're not familiar with CHBs, to go to the website and run through the website to give a little bit better idea about what the CHBs do, who they cater to, who they are, what their mandate is. and then have the conversation. The CHBs meetings are always open to the public. So if anyone wants to come to a meeting, you can. That's just if you're not actually part of the CHB and you haven't been appointed, you can't vote, but it's always open to the public. So anyone can attend, they can get a feel. That's what we encourage. The coordinators always encourage the someone to attend a meeting before they actually become a volunteer.
It's having a problem unmuting there. Any other questions or thoughts or even experiences folks want to share? I know many of us have had interaction and relationships with our community health boards or are curious to get involved themselves. So, okay. Oh, sorry. Go ahead, Dale.
Trying to unmute as well. I've been listening closely to what's been said, and I see the value. And I went on the Nova Scotia Health site there to volunteering, and it says right now that because of COVID, nothing's happening. So if you can't, so I'm just wondering how one gets to to get an application.
So thanks for bringing that up, Dale. And that's an issue we've had sometimes before through volunteer services. So volunteer services, that's the umbrella part of the program, Nova Scotia Health, that someone applies. And it's happened before where we're a little bit of an anomaly. As I mentioned before, there's still parts of Nova Scotia Health that don't know community health boards. So we've had to connect with volunteer services, and it looks like we're going to have to do it again because we've brought that to their attention before. That particular piece is more for volunteers that are actually inside the facility. So anybody like the patient family advisors, cancer care volunteers, there's a myriad of volunteers through Nova Scotia Health, but with community health boards, that whole process, that doesn't necessarily apply because usually the CHB members, they're meeting out in the community. We've always recommended and encouraged the CHBs to actually meet in community facilities. So that means that doesn't put us in that criteria, but we've had the same issues before. Someone's come up and said, listen, I'm trying to apply, but saying I'm not allowed. So we've had to go through and bypass that and say, no, you're fine. We usually connect that person with our volunteer service consultant. So each zone has a volunteer service consultant that we say, hey, listen, so-and-so is having a problem. They just tried to go through the Nova Scotia Health and stay in. They're not allowed to volunteer because of COVID. So I'm going to send them to you, and then that's how we usually deal with that. So we've dealt with that in the Eastern Zone with Cyril McDonald, actually, is our volunteer service consultant in the Eastern Zone, and Sarush. So there's the same one or two people. So there's a Cyril and Sarush in each one of the other three zones that we put these people in contact with and said, listen, okay, go through this person and they'll help you out. Thanks, Dale.
And happy to say that Cyril McDonald, who represents this end, is actually a counselor
Yes.
At the Cape Breton Regional Municipality too. So always easy to find and reach out to him as well. He does a great job in both of his roles.
Yep.
And thanks, Dale, for doing that quick investigation as well. Really appreciate it.
Mm-hmm.
Any further questions, folks? Just going to take a quick peek around. So again, I just want to say thank you, Aron, for engaging with us this morning, for answering questions, and also for your offer of continued communication. I think this is something, as we are kind of re-entering into this world of community activity again, the community health boards will be playing a really big role. I know a lot of our nonprofit organizations are really gearing up again, and our mindsets have changed. There's so much thoughtfulness going into how do we make our communities healthy, and that takes on so many different roles. And so I know that the community health boards, the determinants of health, the priority setting for the regions is going to be really, really, really helpful and beneficial to a lot of our communities and our councils as well. Quite frankly, when we're talking about investment into infrastructure and what have you, it'd be great to have the health boards kind of partner in with our municipal units as well. in that planning and thoughtfulness. So just want to say thank you to everybody, to our staff at NSFM, again, Aron, and to everybody who participates in these webinars. The sharing, the learning, it's so important. And again, we will absolutely be sharing the video of this. So if you wanted to make sure that your council members and friends in the community have access to this, no problem, and the presentation as well.
Yeah, no, I appreciate the opportunity to be here today. And I'll just finish off by saying that if you do want any more specific information, just to Dale's comment before, if there's people's names that you want, like whether it's managers or coordinators or chairs that fall within your jurisdiction, I can get that for you lickety split. So I have no problem doing that and helping out wherever I can.
I can flip your email to everybody in the group here too, Aron. Hold on a
Yeah.
second, just so everybody has it on hand.
Yeah.
There's Aron's email address. So, really appreciate this open dialogue too, Aron. Thank you so kindly.
Yeah, thank you. Always a pleasure, Amanda. And thanks everyone. Nice meeting everyone as well too.